Thank you. Thank you so much. It's really it's an honor to be here, and I really want to continue presenting this as a message of hope. I tweaked my title to say that faith and science agree, and the subtitle is Authentic Faith and Science Cooperate to Heal Minds, Embrace Bodies, and Save Lives. I do want to point out, I consider myself very privileged to be friends with two of those pictured on my cover slide. In the center is Mr. Walter Heyer. He lived as a woman for 8 years, and Walter and I have been guest speakers at a number of conferences together, and his salvation is Jesus Christ. And what led him to healing was a combination of true biblical Christianity and a Christian counselor. So again, it's faith and science that really brought him out, and he has run a tremendous international ministry reaching out to all those with sex change regret for at least the last 15 years now. Just to the left of Walter Heyer is Laura Perry, and she is an amazing young woman who fell away from her Christian faith, and she experienced same-sex attraction and then went over to decided in the midst of our confusing culture that she was actually a man trapped in a woman's body. So as an older teen, she actually went on testosterone, had a double mastectomy, and it was not until after living with another woman that, again, she had a beard, Laura was presenting as a male, she experienced a religious conversion, and that started her on the road, on the path to healing. And now she speaks out. She reconciled with her family. She is re-embraced her Christianity and promoting both true counseling and, of course, the one true faith. Kathy Grace is the one other woman pictured. I have not had the privilege of meeting her, but if you Google Kathy Grace, she also has a very powerful story of healing. And here in the center of this slide, I wanted to feature another group called changed.org. If you go to changed.org, this is a ministry of Bethel Church in California, Southern California. Elizabeth Woenig, Reverend Elizabeth Woenig, is the co-founder of change.org, and they serve both those with same-sex attraction and those with transgender belief. And they're doing phenomenal work. They also, so although my organization, the American College of Pediatricians, is secular, it's non-sectarian, we collaborate with other medical groups, and we will also collaborate with faith groups, because what we're about is getting the true science out to everyone. So today, and I think you heard about this a bit from Dr. Branch yesterday, what we are dealing with in the transgender movement is not medicine, it's not science, it's really pagan belief. It's this Gnostic belief that, we are spirit and body, but the physical is less than than that spiritual essence. And we know from the Bible, as well as medicine, which I'll get to, that a human being is body and soul united, not just some spiritual entity floating around in a shell that doesn't matter. But so it's important, especially for Christians, to understand that this is not fundamentally about science. This is fundamentally about a worldview. It's fundamentally about a pagan belief. And the quotes that I have on the slide Dr. Deanna Adkins is the leader of the gender clinic at Duke University. And what she has gone on record to say that it's counter to medical science to use chromosomes, hormones, reproductive organs, external genitalia, or anything physical to override gender identity in determining sex. What she has just said is, like, it should land her on the unemployment line. I mean, science and medicine are about physical reality. Chromosomes are physical. Reproductive organs are physical. Secondary sex characteristics, physical. That has always defined what it means to be male or female, and it still defines it today. So that's an example of a pediatric doctor who has clearly embraced Gnosticism, but she's trying to paint it as science. Dr. Diane Ehrensaft is a psychologist who is also one of the leading pro-mutilate children voices. And she has been teaching medical students, parents, anyone who will listen, that we can't know anyone's sex unless they tell us, because some boys have vaginas and some girls have penises. And it just exemplifies that when you have people in power repeating a lie often enough, it becomes accepted as truth, no matter how ridiculous it is. So again, looking back even in medicine and in science, the definition of sex in all the life sciences, whether you're talking animals or plants, all the life sciences, define sex according to whether an organism donates genetic material during reproduction or receives genetic material during reproduction. So males, whether it's a male plant or a male animal, donate, think sperm, right? They contribute the sperm to the new life, whereas the female of a species receives that sperm. The female has an ovum or an egg, and it's the sperm and the egg together that make the new life. So this has always been the objective scientific definition of, are you male, a genetic donor, or are you female, the genetic recipient? That has always been the basis, and it still is. So in human beings, the primary sex determination happens at fertilization, and that's because, and it's genetic. The genes that determine whether you will be male or female, there are many of them located on the X and the Y chromosomes. And it's 100% genetic. Sex hormones, drugs, and surgeries can change appearance, but they cannot change your genetic, your genes. They cannot change your genetic foundation. And because of that, drugs, hormones, and surgeries can never change your sex. It is physically, scientifically impossible to take a man and change him into a woman, or to take a woman and change her into a man. What about intersex? Now this is, when we have activists on any issue, they will try to, the first thing they will attack is language. So intersex should really be two words. It should be intersex conditions. Everyone is designed male or female from fertilization. But just as a baby who's conceived at fertilization and normally would have, let's say, a fully formed mouth, sometimes at birth, there are babies born with a cleft in their lip or a cleft in the roof of their mouth. We know they're still human. We know that the cleft in the lip or the cleft in the roof of the mouth is a disorder. So the same thing is true when babies are born with genitalia that are difficult to discern. So disorders of sex development is the medical phrase used for intersex conditions. they represent birth defects, not extra sexes. Sex is determined by, are you a genetic donor during reproduction or a genetic recipient during reproduction? You either have sperm or eggs during reproduction. Those with intersex conditions have impaired fertility. They have birth defects at the level of their reproductive organs or their external genitalia. Fortunately, this is very, very rare. It affects 0.02% of live births. Now, it's still a tragedy. I don't want to minimize anyone who experiences intersex conditions, but when the transgender movement references intersex, they are really they're exploiting this group of people to further their own political agenda. So that's the point that I wanted to make there. So sex means male or female. It is binary. There's only two choices. Gender really refers to masculine versus feminine. And prior to the 1960s, gender was only used when you were speaking about language. So for example, in Spanish, if I have a male friend, it's amigo. If I have a female friend, in Spanish, we would say amiga. Gender referred just to language, to grammar. And I can remember growing up in the 70s, if I ever had a form to fill out in school, doctor's office, anywhere, you were asked, what sex are you, male or female? It did not ask about gender. So there was a clear distinction. That started to change in the 1970s. Everything starts in the academics, college, the ivory towers, if you will, with radical feminist theory, queer theory, these ideas, and the engineering of language, if you will, starts in the upper levels of academia, and then it percolates down through various institutions. It was the late 1950s, Dr. John Money was a sexologist who he would treat men who thought they were trapped in the wrong body. He would treat them with hormones and referred them for surgeries, even in the late 50s. He was the first one to justify what he was doing, redefine gender. He said, you know what, I know I'm not treating their sex. We can't change anyone's sex. But you know what? Everybody has this thing called a gender, which is this internal sexed identity that they're born with, and that is different from their biological sex for some people. He literally pulled it out of thin air, and of course his fellow sexologists saw the utility of that. It would justify them sending these men for mutilating surgeries and getting paid for it. So it started out in that, with that one man in that one field, and then it grew legs in the 70s with radical feminism and queer theory. So today, we now have gender being used interchangeably with sex, and we're told there's hundreds of genders to choose from. Gender identity is really then, it's a category of identification. It exists in the mind. It's not something you're born with. And the most important line from this slide is that atypical gender identities, people who think they were trans, there are numerous studies and numerous case reports of people healing and having these identities change to actually embrace their bodies. It goes back decades. So it is there in the mental health literature, but it's being suppressed now. And transgender, if you go to a gender clinic, they will tell you that transgender reflects a broad spectrum of people who transiently or persistently identify with a gender different from that individual's biological sex. the first time I read this, I almost fell out of my chair. Are you kidding me? Because all we hear is that you are born this way and it can't change. Don't you dare question anyone who says their gender is XYZ. And yet, in this official definition, which you can find in the American Psychiatric Association's Bible, the DSM-5, it says individuals may believe this transiently, that means temporarily, or persistently. So which is it? But see, they want to have it both ways. And that's why, for example, up in Harvard, I think Harvard was the first university that said, hey, students can change their gender from day to day. And Tumblr is one of the social platforms that currently lists 112 genders to choose from. Trust me, there's only 2 sexes, male or female. So prior to the adult transgender activism, medicine was in agreement with, this is Dr. Paul McHugh, who's pictured up top. He is probably the most important psychiatrist, American psychiatrist of the last 50 years. In 1979, he successfully shut down the Johns Hopkins transgender program because he had completed a study that demonstrated the adult patients who went through the Johns Hopkins program had absolutely no healing of their underlying psychological conditions after their hormones and surgeries. And so in 1979, his study was published, and he said, look, we've got to close this down. We are not doing these people any favors. We're not healing them, and we're putting them through these dangerous surgeries and on dangerous drugs. So there was some moments of sanity in which the transgender belief was seen in the same category as anorexia or eating disorders, in which especially girls, but it can impact boys too, believe that they are obese and incredibly fat, and when in fact they are skin and bones. They're starving themselves. And there are 2 other similar disorders. The body dysmorphic disorder shows a woman sort of clawing at her face. These individuals believe that they are horribly scarred, or that there's something malformed about their face or part of their body. And the most extreme case, which is very similar to gender identity disorder or gender dysphoria, would be the body integrity identity disorder. These are individuals, the common term is transableism, individuals who believe they are crippled or paralyzed or otherwise disabled when in fact their bodies are physically healthy. And these individuals will seek out, they are so distressed by a healthy body that they will seek out surgeons to amputate limbs or to cut their spine so that they become truly paralyzed. And you can see the relationship here, or the similarity, because an individual with transgender belief is so distressed by their bodies, they want to cut off their sexual organs to imitate the opposite sex. So that similarity used to be readily recognized. Now it's suppressed. Dr. McHugh was also quick to point out that the transgender belief was perhaps the person's, the mind's attempt to escape the pain from other psychological illness, such as major depression or psychosis or sexual abuse, physical abuse. The mind, and I like to, as a Christian, I like, and I firmly believe that God designed us to be resilient and to heal, that we have this, our bodies and our minds have this healing drive within us. But with the fall, with the fall, disease, suffering, and death entered, and so our innate mechanisms kind of went a little askew. So that's how I visualize it as a Christian, and I would say that the psychiatric literature does support that, because if we treat these underlying problems, if we can meet with a child or teen in the family and sort through and uncover some underlying issues and treat those, then the transgender belief goes away. It's not easy, it's hard work, but it does happen. There was a very recent study in Australia that looked at a very large sample of children and their families who presented to a gender clinic. 89% of the children between the ages of 8 and 15 who went to this clinic saying that they were transgender, 89% had a history of mental illness before they ever had transgender belief, and it was untreated mental illness. 98% of those children had a history of traumatic events in the past. And on average, of those 98% of those kids on average had 5, not just one trauma, such as, let's say, verbal abuse, but they had 5 traumas in their history. And when I first began speaking out against hormones and surgeries for children with transgender belief, I received a phone call at the office from a counselor in San Francisco who has worked with adult, mostly men, who identify as transgender for the last 20 years. And this counselor said to me, he said, I can't tell you my name or where I work because he would be fired, but he said, I wanted to thank you for speaking out. You need to know you're saving lives when you say that underlying traumas or illness cause this. He says, I've worked with these men for 20 years, and 100% of them have a history of horrible traumas in their childhood. Not just sexual abuse, but for the men anyway, he said sexual abuse was very common. We are always hearing that it's compassionate to put adults on cross-sex hormones because the studies show that this is good for them. And so based on the adult science, we should do that for the kids. The fact is, when an independent organization called the Hayes Incorporated, and we've known this since 2014, there are earlier studies too, but in 2014, Hayes Incorporated did a huge meta-analysis and said, absolutely not. The studies we have, there is a very weak evidence base. Improvement after the hormones is not consistently demonstrated. The evidence for improved quality of life, very sparse. And what we do see, this organization said, is significant long-term safety risks. What kind of risks do we find when we look at men who are put on estrogen because they believe they're really women? Over twice as many, they have over twice as many strokes as biological women, and twice as many as their peer men who are not on estrogen. Men who are put on estrogen for their transgender belief have 5 times as many deep vein clots as true women, and nearly 5 times as many as their peers, as their male peers. They are also at risk of twice as many heart attacks as women. So we're talking blood clots, heart attacks, strokes. There's also a cancer risk. This group of scientists also looked at women who believe that they're actually men and are therefore put on testosterone. They have 4 times as many heart attacks as non-transgendering women. So again, risks of the oral estrogen to men: blood clots, strokes, heart attacks, diabetes, and cancers. Testosterone, what harm does this cause adult females? heart attacks, diabetes, liver disease, sleep apnea, and cancers. These are not harmless drugs that we're putting vulnerable adults and children on. What about the cross-sex surgeries? I already alluded to this. The same organization, Hayes Incorporated in 2014, again, looked at every published study claiming that surgeries are helpful to people with transgender belief. Serious limitations in every study. So they said the evidence is very weak. In 2020, we had a brand new study out of Sweden, and this study demonstrated harm. Transitioned adults fared worse than trans-believing adults who were denied surgery. So this was the first study that actually looked at a large group of transgender-believing adults in which some went to surgery and others were told, oh, the surgery, you're not a good surgical candidate. Those who were denied surgery actually did better mentally and physically than those who went on to get the surgery. But we don't hear about this from the mainstream media or mainstream medicine, because unfortunately, mainstream medicine is highly politicized, and these drugs and surgeries are highly profitable. I don't mean to impugn any individual physician, because as physicians, we are so overwhelmed by the latest discoveries and keeping up that unfortunately we tend to rely on the experts in that particular field. So I don't want to impugn individual physicians. A lot of physicians are misled, but those in authority absolutely do know better. We are often told that there are many, many studies to prove that this is effective, and Dr. D'Angelo is one. He's a psychologist in Australia who is pushing back against the activism. He pulled the top 6 studies that the other side says, look, these prove effectiveness, and he said, look at the last column. You're claiming that your studies prove effectiveness, but you can't account for like 20 to 60% of your patients. Why are your patients missing? Did they kill themselves? I mean, as you go through, so in his paper, he reviewed these studies and said, certain studies said, oh, we couldn't get in touch with 60% of our original population of patients. Some of that 60% refused to answer. Why did they refuse to answer? Are they unhappy with their results? Are they dead? We don't know. So this is the kind of deceit that goes on up in the upper echelons of academic medicine and academic psychiatry that the rest of us aren't privy to. And for the same reason, there are studies that claim to look at regret. Well, how many of these individuals who have the surgery actually regret it after 5, 10, 20 years? And again, these are the top studies that claim, oh, there's only 2% who actually regret it. But the one study that actually went and contacted every patient who had surgery found that 30% of them had significant regret. So if we were creating a new drug and wanted that new drug to go to market and found that it caused harm in 30%, that drug would not go to market. See? So these are the games that are played. Suicide. We are often told that, look, you have to allow, especially kids, to go on these drugs and get the surgeries, or else they're going to kill themselves. 2 very long-term studies looked at 2 different measures of suicide. One in the Netherlands found that those individuals who get the hormones and surgeries have a nearly 6 times greater suicide rate than the general population. that was in the Netherlands. Another study, also very large, over a 30-year period, found the completed suicide rate. They followed for 30 years. At the end of 30 years, the suicide rate in those who had surgery was 19 times greater than the suicide rate of the general population. So there might be a honeymoon period, just like it's similar to when, if you're involved in the pro-life movement and you speak to women who've had abortions, many of these women may say, well, you know what, initially I had my abortion and, okay, the problem pregnancy was gone. There was this little relief, reprieve. Some who undergo the hormones and the surgery also experience this little relief because they are convinced that it's their physical body that's the problem. And now that they look more the way they want to appear, they have this little honeymoon period. But by 10 years after surgery, gone. No honeymoon period. The mental illness spikes up. Why? Because you've not treated the underlying issues. Counseling really remains unstudied, and this has been admitted by Dr. Ken Zucker, who treated children successfully for 35 years in Canada. In one of his peer-reviewed articles, he pointed out that there are many cases of adults also healing, but the study of adult success is not encouraged and in fact is discouraged by the psychiatric authorities right now in power. There are in fact 16 case reports that a colleague and I found that do exist to demonstrate that adults and teenagers can heal, can come to embrace their bodies. And I sort of paraphrase Chesterton here. Modern psychotherapy to align the mind with the body has not been tried and found wanting. Modern psychotherapy to align the mind with the body is not wanted and remains untried. And that's the sad truth right now. Social affirmation and puberty blockers in children is a self-fulfilling prophecy. We have now at least 5 studies that have looked at children with transgender belief. When they are given the puberty blockers, nearly 100% will go on to ask for cross-sex hormones. And it makes sense because we know from studies prior to all the activism that the families that sought counseling, the first thing that Dr. Zucker and his colleagues would say is, well, do not allow your child to cross-dress. Do not change your child's name. Do not affirm their false belief. Affirm that you love them the way they are for the son or daughter they are. It's okay to be a girl with different interests. It's okay to be a boy with different interests, to break stereotypes, but you're still, as Christians we would say, you're still the boy that God made you. You're the girl that God made you. Our identities as Christians, our identity is in Jesus Christ as a precious daughter of God, a precious son of God. Like that's really powerful that the secular world doesn't have. And it truly is a unity. Faith and reason, faith and science together is the best way forward. So when it comes to puberty blockers, these are drugs given to children between the ages of 8 and 13, and it prevents them from developing, from maturing sexually. But not just sexually, it also arrests brain development and bone development. Sex hormones affect the entire body. So when you block puberty is not a disease. Puberty is not a disease. Yeah. So when you take a critical, healthy developmental period, it's a challenging period, I'll give you that. I don't remember liking puberty. I don't know anyone who really does. But it's a critical developmental period, physically, emotionally, socially, and we're just freezing these young children who are already emotionally troubled. We're freezing them like that, while their friends and peers are progressing on to become the boys and girls, young men and women that God made them to be. We are actually, when we're creating a disease, it's the absence of puberty that is disease, right? And so we're giving a physical disease to these children who have emotional distress already. It is wrong. It is wrong to steal puberty and rob these children of the developmental stage during which the majority would outgrow their confusion. If we accompanied them with loving affirmation of the son, the true son or daughter they are. Dr. James Cantor is a psychologist who is very liberal, and I put him up on the screen because he is deeply concerned about putting kids on the hormones and giving them surgeries. And he actually went through the American Academy of Pediatrics statement. The AAP is basically pediatricians who put out the Democratic Party platform as science. At least wherever wherever sexual health is concerned, it's basically the Democratic Party platform. And Dr. Cantor, who, as I said, he identifies as, he's openly homosexual. He is not a Christian conservative. I think he also identifies as atheist. But he went through all the science, and he said the American Academy of Pediatrics claims that their statement is based on science. It's not. He says, as a matter of fact, every reference in their position statement calls for watchful waiting with kids. So the references of the AAP position statement contradicts their claim. And this is consistent, there is no evidence, there is no true scientific evidence to say that puberty blockers, cross-sex hormones, and surgeries are safe or effective for children with transgender belief. But despite this, since 2007, we have seen gender clinics spread like wildfire. There's over 69 now, and Planned Parenthood clinics also distribute the hormones. The Endocrine Society is another professional medical society that pushes hormones and surgeries for children and adults. But what's ironic is that in their own publication, they admit that it's based on very low to low evidence, and that the only guidelines based on moderate scientific evidence are those that warn about harm. Two out of the 22 guidelines are based on strong scientific evidence, and those are the two that say you have to monitor for serious side effects from the puberty blockers and cross-sex hormones in children. Again, we are always hearing blockers decrease suicide risk. Dr. Jack Turbin is, I believe he's a recent Yale graduate, and he's going into adolescent psychiatry, unfortunately. Well, we pray for him. But he published a study that, in his title, and as well as abstract and conclusion, he claimed his study proves that puberty blockers decrease suicide risk. But if you actually look at Table 3 in his very own paper, you will see that the children who are on puberty blockers had double the rate of serious suicide attempts requiring hospitalization. So his own data contradicts his conclusion, but he gets published widely. The number one puberty blocker in America is Lupron. If you read the package insert of Lupron, it warns that it can cause psychiatric illness. It warns about depression, distress, anxiety, worsening psychiatric symptoms. But that's what we're giving to children with emotional distress because If we don't give it to them, they're going to kill themselves. So it's lie and half-truth after lie and half-truth. Side effects of the puberty blockers. Oh, but Dr. Cretella, if you stop the puberty blockers, the child's own hormones will kick in. Maybe, it depends, but here's the trick. You can have permanent harm from temporary use. You can still have permanent harm from temporary use. Why? Because no one has invented a time machine yet. If I take an 8-year-old and put that 8-year-old on puberty blockers for 2 or 3 years, and then take the 8-year-old off, I still robbed that 8-year-old of 2 or 3 years of normal psychosocial and physical development. I can't give them those healthy, normal 2 or 3 years back. So that is permanently stolen, and that is an objective harm. But we also know that physically, if children are on the puberty blockers, those children cannot recover the bone loss. So there is permanent bone loss. We also know that should those children go on puberty blockers and then get the cross-sex hormones, now they will never produce eggs if they're girls or sperm if they're boys. So the combination of puberty blockers and cross-sex hormones, we're sterilizing children. So no, puberty is not a disease. If you block normal puberty, you're causing a disease, and it's objectively not good for the child. And again, is suicide the only outcome if we do not go the route of medicine and surgeries? And absolutely not. We know, pictured here, the American Psychological Association has a red reference book, Psychology and Sexuality. The purple book is the Diagnostic and Statistical Manual, 5th edition, from the American Psychiatric Association. The vast majority, up to 98% of gender-confused boys and up to 88% of gender-confused girls, prior to the activism, would recover. They would come to embrace their physical bodies. They would be physically and emotionally whole by young adulthood. Now, this is not to minimize suicide. Suicidal thoughts, suicide threats should always be taken seriously and as a cry for help. That is not a question at all. But what the activists overlook is that youth with transgender belief are in the same category as youth with other psychological illnesses when it comes to suicide risk. So the activists would have us believe that transgender believing youth are way up here at their risk for suicide, and then you have other psychological illness where, yeah, their risk is down here, and then you have the general population. Because transgender belief is triggered by depression, anxiety, it's very much associated with anorexia nervosa and ADHD and autism. They're all at the same level of increased risk for suicide. And that's what those numbers reflect here. This was a study published by a Dr. Briggs in the UK, and he found that youth who have transgender belief, their suicide risk factor, it was increased by 13. Youth who have depression, their increased risk was a factor of 20. So we're in the similar ranges as these other emotional disturbances, which can be treated. And we also know that there's significant overlap. Rational and compassionate medicine is not driven by a threat of suicide. Never before in the history of psychiatry or medicine would a doctor or a therapist, if a patient comes, and I've had this happen, when I was in practice many times, please help me, I want to kill myself. I had one young woman who said, every time now that I get behind, for the past week, every time I get behind the wheel of my car, I just envision myself plowing into a brick wall, but I don't want to die. I have a 2-year-old, she was 19, she had a 2-year-old little girl. Please help me. Yeah. I said, oh my gosh, of course, I'm going to help you. It's a cry for help. I don't care what comes along with the suicidal desire. It's, and I gave her a hug. I don't care what the underlying belief is that accompanies this. It's love first. Love first. We don't say, oh, here's my prescription pad. What do you suggest I write out for you? And yet, that is what we do to 5-year-old, 8-year-old children now. Oh, Joey says he's a girl. Oh yeah, let him grow his hair long, make him Josephine, and everybody's got to play along, or else he's going to kill himself. Time out. We're repeatedly told and shown studies that say children, the trans-believing children who are affirmed, are okay and doing well. These are 2 studies that are from 2016 and 2017, very often referenced. A friend of mine, Dr. Walter Shum, he's a sociologist with, he's partially retired now, Kansas State University, but just an amazing scientist. He reanalyzed the data of those 2 studies, and he got the sense, as a statistician, he said, wait a minute, there's something missing in these studies. He wrote the primary authors, and they provided him, they said, oh yes, you're right, we did look for those numbers, and we do have the data. And he said, well, would you share it with me? And they did. And so he went and he recrunched all the numbers with the missing data. And lo and behold, the exact opposite conclusion is reached. When you include the data they omitted, you actually find that the children who are affirmed in their gender confusion do worse than those who are than their normally matched peers, and they get worse the longer they are affirmed. But you won't hear about his published study. And I know I probably have only about 10 minutes. All right, so what about, I just want to unpack a little bit or demystify, what about the brain studies we hear about? Where pediatricians are telling parents, oh, your child was born with a brain that's on a different page from their body. Okay, newsflash, the brain is part of the body. The brain is part of the body, and every single cell of our body with a nucleus has the very same sex chromosomes, the very same sex-determining genes. So no, that is just science fiction. But what do we make of these MRI studies that we hear of? Well, let's take a step back and look at eating disorders. Nobody says that people are born with eating disorders. People might talk about, oh, you might have an influence, some biological influence in your family that might predispose, but nobody says, oh my gosh, I'm so sorry, Mrs. Jones, your daughter has anorexia nervosa, there's nothing we can do. We can't, we're just going to have to try and supplement her calories IV and let her starve herself. Nobody says that. Yet, there are many, many brain studies to show that there are brain differences between girls and boys with eating disorders and girls and boys without eating disorders. Nobody says that they have fat brains trapped in skinny bodies, because it's not a political issue. Eating disorders is not a political issue. In the case of eating disorders, it is safe to say, hey, you know what? The brain is a muscle. And if you alter your behavior, if you alter your thinking, you will change the appearance and the physiology of your brain. Transgender belief is a political issue. So even though those brain studies are far fewer and of lesser quality than the brain studies for eating disorders, we're told all the time, oh, this picture, this MRI proves that it's a girl brain trapped in a boy body. Or the other, this one hasn't gotten as much traction. The other thing that I've read in the scientific literature is that, oh, everyone's born with a mosaic brain. No. From prenatal development, we know genetically from fertilization, every male embryo has a male sex in every cell of his body. Every female embryo has a female sex, chromosomes, genes, genetics in her body from the beginning. By 8 weeks gestation, the male unborn babies are producing their own testosterone because their testes are functioning. Girl babies, unborn girl babies, don't make testes because they're girl babies. They don't generate testosterone. So every baby girl at birth, she's got a girl brain. Every baby boy at birth, he's got a boy brain. Scientifically, there's no question. And again, what is really going on when people flash up different pictures of brains, we know for a fact that the medical term is neuroplasticity. The brain is like a muscle. And we have demonstrated, neuroscientists have demonstrated differences, even looking at people who pray versus, or I guess you would say they could image people before they begin an intense session or habit of intense praying. So you do the before and the after, and you can demonstrate functional changes in the brain as well as physical differences. They've demonstrated this with music, violinists, pianists, athletes, juggling. So this is not unique to transgender belief. I don't know if this is at one time, twin studies were also thrown around quite publicly as saying, well, you know, in the case of twins, you're more likely to find that the twins will both identify as transgender. Again, take a step back. Let's look at eating disorders. Identical twins. If you look at identical twins and go to figure out how many of those identical twin pairs, what percentage are they both affected with eating disorders? It's much higher than the general population. If you look at identical twins, 44% to 70% of identical twin pairs will both have an eating disorder. Nobody says, ha, it proves it's genetic and there's nothing we can do about those eating disorders. No. When you have a higher incidence among identical twins, it does suggest there might be a biological influence, but the only way that you would need to have 100% agreement. 100% of all identical twins would have to have the same trait for us to say, oh, that's caused by genes alone. So as an example, identical twins have virtually the same skin color 100% of the time because skin color is not influenced by how you're raised or by what you eat or where you go to school. Skin color is determined by genes alone. So anorexia nervosa, it is more common among identical twins than the general population. But if you look at gender belief. Identical twins match for transgender belief only 28% of the time. So the genetic influence for transgender belief is less than the genetic influence for eating disorders. The bottom line, genes alone do not determine either disorder. And that's a basic truth of behavioral genetics. So when you look at transgender belief, so what does cause this? What contributes? It's no one thing. Transgender belief, it's really like asking, so why do I do what I do? Why do I have any behavior? We all have idiosyncrasies. We all have traits or habits that don't serve us well, that we need to change. Why did those develop? It's a combination of, we're made of DNA, so our makeup, our DNA, our biology certainly is part of the reason. But social reinforcement, our family life, our schools, clubs, now, my goodness, the internet, the media we ingest. Is there mental illness in the family? Our parents, and now there's plenty of, and I think we unfortunately have a culture that looks down on people who are struggling with depression or anxiety, but my goodness, we have lots of reason to be depressed and anxious people, right? So I think, and having a parent who is depressed or anxious, it impacts the whole family system. Traumas. Sadly, physical abuse, verbal abuse, and sexual abuse, sadly, are rampant these days. Children who are born on the autism spectrum, they already have difficulty understanding social cues, socializing, forming friendships, and it's very easy for youth or adults on the autism spectrum to become enamored by transgender clubs or LGBT clubs who say, oh my gosh, yes, you're different just like us. And these things you're experiencing, it's because you're actually trapped in the wrong body. And there are adult transgender activists online who do prey on emotionally troubled youth. Binges on the internet are very common among children and teenagers who develop transgender belief. But again, it's a combination of factors. Divorce in a family is a common trigger for teen girls to all of a sudden they just snap and become ensnared in transgender activism and the belief that their depression or anxiety, which has probably been related to family issues all along, but the divorce happens and they just, as a teenager, the teenage mind just latches on for the easiest explanation. The teenager's job is to figure out who they are and get an identity, and now with the transgender culture, it's right there in front of them. And this will be my last slide, actually my second to last slide. This graph is the bold blue line is when Facebook launched. I believe it goes Facebook, Twitter, then Instagram. So Facebook blue, Twitter green, Instagram red. And with the launch of each social media site, what you're seeing with the jagged lines, the light gray jagged line, which is most high, that is the increased incidence of girls coming out with transgender belief. And the darker gray line beneath them is the increase among boys. And in the corners, I'm just illustrating the various, everything from books to the internet to schools, public libraries, TV, obviously. These are all indoctrinating our youth and adults into the transgender ideology. And so finally, faith in science. This is where the hope is found. Faith authentic faith and authentic science do agree. Transgender belief is a belief. The pain is real, but it's not inborn. It is changeable. Counseling to embrace the reality of one's body is possible. And despite what we are hearing from the powers that be, puberty blockers, wrong sex hormones, and surgeries are dangerous, especially for our children. There's no evidence that those things prevent suicide. There is evidence of harm, even resulting in suicide. So please hold on to, we have to keep the faith. We have to love our kids authentically. Without truth, it's not real love. Truth and love, faith and reason. Thank you.